we just recently, in the past year or so, hired some IPs, and I look for someone who can be a self-starter. I don't like to micromanage. I like to say, here's the expectation. We're at point A. I want us at point B. And I will not micromanage how the team gets us from point A to point B. Because one of the valuable lessons I learned is no one can know everything, and there's more than one correct way to skin a cat, so to speak. And so as a leader, I have learned to rely on the team, their input, speaking up. Many of them have dealt with similar situations, but maybe within the OR. And so they can bring good knowledge to it. I think you need to have a team that's fairly diverse. My team, we have 4 generations, so I'm a multi-generational team. We have baby boomers, I have Gen Xers, I have millennials, and we just hired a Gen Z. And I've learned my millennials prefer to communicate over Teams chat. And I'm okay with that, but I have said to them, if there's something I need to keep documentation of, it will be coming via email, because you can't keep anything versus Teams chat. So learning to work with multidisciplinary and multi-generational workforces. We have nurses, we have laboratorians, even outside of myself, and we have a couple of MPHs as well. And I'm very proud of this team. This is the first role that I did not have to build a team. I think what I had to do for them is they did not have a good leader in place, and so prior to me, and so they had an element of PTSD. And for the first 7 or 8 months that I was in this role, they were like crickets. It was hard to get them to talk, and for me to convince them that I want to hear what they have to say. It is a safe environment. And I think where I broke the ice was at our November department meeting, November of 21, just as we were starting to see that new COVID spike. I could see it picking up. Well, I took time and I asked each person individually, how are you doing? Do you need a day or 2 off to just kind of decompress? What is it I can do for you? They were touched. They said, and in fact, what made me sad is several of them said, nobody in my entire career has ever asked me how I'm doing and what they could do to help me if I'm having problems. It was at that point that I think they understood that I provided a safe environment for them, that we were a team, that I was not always going to do things my way, that I'm willing to try anything. And if it didn't work the first time, okay, let's take 3 steps back and punt and see what plan B is, and things like that. Right now, this team has been covering for me. As we do this interview, I'm recovering from a pretty nasty illness, hopefully going back to work next week. But my team, we were having our Gen Zer starting when I was in the hospital, and they are such a good team. They just picked up where I wasn't capable. They've been orienting the program coordinator. They've been carrying on their normal work and everything. I'd put this team up to any other team in the country. They are just stinking amazing. And as much as I would like to think that some of my influence has helped this, I would also say these folks had these skills all along, and I would like to think that maybe I've given them the comfort or the support to go for it.